many of us enjoy having a glass of wine with dinner. And drinking a glass of wine is just as socially acceptable as drinking tea or even water. However, unlike other beverages, alcohol, including wine, is a drug. Our insiders explain.
Alcohol or ethyl alcohol or ethanol is an intoxicating ingredient that is found in beer, wine, and liquor. Alcohol is produced by fermenting yeast, starches, and sugars.
Right.
So that's basically alcohol.
What alcohol is. Now, I want to remind our viewers that you can call in and ask Dr. Brewster or Dr. Ali a question by dialing 855-796-4475. We'd love to hear from you. Now, Dr. Ali, how does alcohol affect a person?
Oh, that's actually a really good question. I was hoping to get into. Alcohol affects every organ in the body. It's a central nervous system depressant, so it's rapidly absorbed from the stomach and small intestines into the bloodstream, and then the liver metabolizes it. But the problem is that the liver can only metabolize a small amount at a time. So the excess alcohol ends up in the bloodstream, like circulating around the body, causing damage. So
how long does it take for it to metabolize in the liver?
You know, it varies from person to person, but the amount of alcohol that you consume directly affects how it's gonna directly affect how you're gonna feel, and
right.
So the more you drink, the more it's gonna affect you, of course.
Of course. Now we have a story of Anne who fought a 15-year battle with alcohol that started in college. Let's watch, and then we'll talk about it.
In the beginning, I drank no more than the people around me, other college freshmen. But one realization was almost immediately clear. It was more important to me.
Anne, who is 63, fought a 15-year battle with alcohol that began in college. It had a devastating effect on her life.
At the end of 15 years, I was drinking a liter of vodka a day. And by then had lost my first marriage, multiple jobs, the support of my family, and was about to lose the home where I lived.
When she realized she had a problem, she tried to get help, but frequently faltered.
I managed to stay sober for a year, and then almost inevitably drank again, and then another year, and almost inevitably drank again.
Dr. Mark Willenbring, an addiction psychiatrist, says that people with alcohol addiction often try to quit many times before they are successful.
For people with the more severe form of alcohol dependence, where they really do have life disruption, where it's really taking over their lives, quitting is often a lengthy process, and it involves stops and starts.
For me, it was a process, not an aha moment.
Getting help for alcohol addiction is especially difficult if you don't think you have a problem. When she was diagnosed with lung cancer at age 74, Ellen began drinking heavily, although she didn't realize it at first.
I don't think I really was aware of, that alcohol was was a problem, primarily because I was still functioning pretty well with while consuming, as I say, about a liter a day.
I want to go over some reasons why alcohol affects people differently. Dr. Ali, it depends, again, I think we talked about race as well and sex, that affects, and age, correct?
Yeah, so it all depends on how the body of an individual can process the alcohol. You know,
right.
Age can affect how much the liver can process the alcohol. Someone over the age of 65. Sex, for example. Women, they have a different water body composition, and they have a different, set of liver enzymes. And so, processing the alcohol. Race, some ethnicities, they get flushing, they get nausea from drinking alcohol. Physical condition, weight, fitness, amount of food consumed determines how much alcohol might be absorbed. Some medications interact with alcohol. Some medications, alcohol can affect how medication side effects manifest, and family history. Some experts say that 50% of vulnerabilities to alcohol use disorder are coming from genetic factors.
Interesting. Now, are there guidelines as to what is considered a drink, Dr. Brewster?
Yes, the U.S. Standard drink size is equal to 12 grams or 0.6 ounces of pure alcohol. So this is generally found in like 12 ounces of beer, or 8 ounces of a malt liquor, or 5 ounces of wine, or 1.5 ounces of a distilled spirit or liquor or a shot.
But it's so interesting because we actually have, you go to a restaurant, you depending the way they pour as well, they might give you a wine glass and fill it all the way to the
That's
top as
true.
well.
Yeah, you have to be careful. You have to be
Wow.
very careful.
Okay, so what point is someone noticing that they have a problem?
Well, I think if they're starting to feel like it's affecting their lives, if they're seeing their family members looking at them and they're like, maybe you should watch your drinking, if people are saying that to that person,
Right.
they might have to reassess their situation with,
It
with
affects
alcohol.
their work situation, the ability to get work completed at their job.
Okay.
Certainly.
I know this sounds like a silly question, but is it safer to drink certain alcohol over others?
I mean, generally speaking, alcohol is alcohol is alcohol, and those, equivalences that we just had the graphic up show. Safe drinking, generally we'll talk about this as less than 2 drinks, or less for men, and non-pregnant women 1 or less.
Right.
So that's, something that's generally recommended.